Hello, my name is Letitia, and I'm here to talk to you about something that's very near and dear to my heart, and that's the elderly population, our seniors. Working in the healthcare field on and off for the past 20 years, I have noticed a big disparity with our seniors. Not the ones who require 24-hour nursing care, where they're like hooked up to a ventilator or have to be in a nursing home because they can't do for themselves and they depend on somebody 24 hours a day, but the ones who just need a little bit of help. Those who are still able to do certain things for themselves, not everything, but just require a little bit of help. Those that are economically disadvantaged. I've noticed the disparity between them in our healthcare field. I noticed that sometimes they get dropped off at their doctor's appointment and they might miss the appointment because they end up in the wrong place. And by the time somebody realizes it, their appointment time has really passed. Or they're sitting there waiting for a ride to come get them and it's been 2 hours. Or either the nursing home facility that they're in or adult daycare facility or whatever they're in don't have enough staff or help to accompany them to their doctor's appointments. So they drop them off and they go to the appointment, but it's a useless appointment because no one is there to help them understand what's being done or what's needed. No one is there to talk to the provider to help facilitate the proper care for the patient. And I even experienced this with my own mom, where I moved to North Carolina and she didn't want to come with me. So I'm in North Carolina trying to make sure that she's getting the help that she needs. I'm calling her transportation because she's been waiting there for 2 hours. I'm calling her doctor's office, or either I'm stepping out of my job on my break or taking an extra break to talk to the doctors while she's there so I can hear what they're saying, hear what kind of treatment she needs or what they want to do next. I was on the phone with the doctor because she needed a medication refill, or I'm calling her pharmacy trying to figure out what medication is she taking, how much is her medication, or why her medication wasn't delivered. But there's a lot of seniors out there who don't have that help. They don't have anybody that's able to take care of them or willing to take care of them. Then there are those seniors that are economically challenged and they have Medicaid or Medicare. And after a certain point, when it comes down to their prescriptions, they end up in what's called a donut hole, where for a certain amount of time, their medications aren't covered. Or they get disability, or certain medications just aren't covered and they have to make that choice. Do I eat this month or do I buy my groceries? Do I maintain my utilities or do I get my medication? And that's a tough choice to have to make for anybody, let alone a senior citizen who, without their medication, it's life or death for them. So that's where By His Grace LLC comes in at. Our motto and mission is to make seniors feel like they're loved, they're wanted, and somebody actually cares. What we provide is a home setting for about 4 to 5 seniors in each home. It will be still 24-hour care. Someone will be in a home with them 24 hours a day, making sure that they get their needs met, making sure that their medication is taken on time, making sure that they're eating healthy, nutritious meals. They'll go to the grocery store with us and help decide what meals they're going to have, and they're going to help prepare the meals. We'll accompany them to their doctor's appointments, making sure that they're getting the right medication and making sure that they're getting the care that they need, because we're going to be one-on-one partners with their medical providers. We're going to make sure that we're helping them manage their chronic healthcare conditions, because when those aren't managed, they become repeat people at the hospital. We don't want them to have to keep going to the urgent care or the emergency room, getting admitted for weeks at a time. And then when they get out, they go back home. But because they have no one there to look after them or to help them out, they end up back in the emergency room, back at being admitted to the hospital. We want to step in and help them manage those chronic conditions. We want to step in and let them know, hey, somebody heard y'all. Someone is listening. Somebody really do care about you and want to make sure that your needs are met. And that is where By His Grace LLC comes in at. We want to meet that need. We want to help bridge that gap that they're in. And if you feel this way, and you understand and hear our passion and our plea, we hope that you accept us into this program so that we can get to help the seniors out get to what they need. Help me honor my mother's legacy. My mother is gone on, so I can't shower her with love. I can't give her flowers anymore because she's no longer living. But I did give them to her when she was here. So now help me give other seniors their flowers while they're living. Help me honor her memory. I can't take care of my mom, but I can try to take care of as many seniors as I can. Thank you.